Hello and welcome to Fibroman. And today, I kind of feel a little bit more positive about it all today because I was reading something that was in one of the old science papers, like medical science papers, and they found a correlation between hypothyroidism, which I suffer with, but also the fibromyalgia. They've worked out that there is that there is a link there between the two. And where this is actually, well, it's obviously good news anyway, that they've been able to find us some sort of correlation, but where it is, because obviously diagnosis is a huge issue for fibromyalgia sufferers. It's taken about 6 years for me to really get a diagnosis for it from a doctor. Pretty much because they've had to test me for all sorts of stuff over a period of time, and then I sort of I was okay for a bit, and it flares up again, and they test me for something else, and it all comes back negative. It's not an issue. There's no problem there. What the hell's going on with you? And now it seems clear that it's fibromyalgia, all these muscle pains and stuff like that. My voice is buggered, and it's reassuring for other sufferers of fibromyalgia to get a diagnosis quickly. So what they're saying there is that these receptors and stuff you see, and they'll be able to work out. Well, they should be able to devise a test now. Now they can see the correlation for fibromyalgia, which could be a massive relief for people, or not. Personally, I'd rather know what's going on with me than not, if you know what I mean. I really would, and it could be a real life changer to get diagnosed sooner, so people can actually manage the condition much earlier. And at least then they've got an idea what's going on. If you've got a piece of paper saying, yes, you've got fibromyalgia at this rate, or whatever it might be, that's positive stuff. That's good. That's a long way off, obviously, but at least they've found a direct correlation, scientifically, peer-reviewed studies, a correlation between the hypothyroidism and fibromyalgia. The other thing that was it was talked as part of the study, is that they believe there's a possibility of reversing some of the symptoms of fibromyalgia by doing something to the receptors. It's to do with your hormones. Your body's not... The hormones are coming out your thyroid, what have you, to do certain things in your body. And basically the receptors in your body are not they're underactive, and they're not responding to the hormones as they should. And that is why, apparently, according to this study, that I'm not a scientist, this is how I've interpreted it. It's in the shortest way possible, in my head. And they reckon they could actually make the receptors more recepting to the hormone, which would make a huge difference. It could relieve a lot of the symptoms. Because it's a strange condition anyway, to be fair. Sometimes it's obvious, and sometimes it's not. What's going on? Sometimes you just feel grotty. Other times you're just in pain. Other times you're in grotty and in pain. Other times your eyes are fuzzy. Other times your voice is buggered. My voice is buggered at the moment. As you probably hear, I've got very limited range in my voice now. It's all related, you see. See, the thing about the hormones is people don't seem to understand that the hormones, if they're not there, or they're not doing their job, they will affect almost every part of the body that requires those hormones to work. Hence, that's why people with fibromyalgia suffer with so many different ailments, so many different symptoms. Regarding the thyroid, the eyes, the throat, obviously pain, that's the most common one. Gut, IBS, all sorts of stuff. Especially everything. It's like, oh, crikey. But this is positive. So anyway, I would be interested in knowing what you think. Please leave it in the comments down below. It's quite nice to know that actually some people are actually doing what they can to learn about it as well. Toodaloo.